Goni Thoracic and Lumbar rotation. Position the patient in sitting, unsupported, with the feet on the floor to help stabilize the pelvis. The cervical, thoracic, and lumbar spine are in 0 degrees of flexion, extension, and lateral flexion. In patient-appropriate language, ask the patient to rotate as far as possible, keeping the trunk erect and feet flat on the floor. Assess the pelvis for rotation and the spine for flexion, extension, and lateral rotation. Place your hands on the shoulders of the patient. Brace the leg opposite the direction being measured. Passively turn the patient at the shoulders. The normal infeel of the joint is firm because of tension in the contralateral fibers of the annulus, facet joint capsules, intertransverse ligaments, and supraspinatus, interspinous, and iliolumbar ligaments. Various muscles also contribute to this infeel. Refer to your text for a complete list. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis over the center of the cranial aspect of the patient's head. Align the stationary arm parallel to an imaginary line between the two anterior superior iliac spines. Align the movable arm with an imaginary line between the two acromial processes. Ask the patient to perform trunk rotation as previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the pelvis. Read the degrees of motion on the goniometer and then ask the patient to return the trunk to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 45 degrees.